Aravind is the world's largest eye care center, a one-stop shop that even makes many of the lenses and instruments used by its surgeons. It looks like any of India's high-tech centers where rich Indians and medical tourists can get first-world care at third-world prices. The surgical error rate is as low here as any place in America. The big difference at Aravind is that its patients are among the world's poorest people.
Next, a story about a miracle-working eye hospital in India.
20 years ago, I visited Aravind's founder, Dr. Govindappa Venkatswamy. Everybody called him Dr. V. He'd retired from a government hospital in 1976 and set out to tackle needless blindness. Worldwide, 45 million people still suffer from preventable or reversible blindness. 12 million are in India alone, where the extreme sun and a genetic predisposition are blamed. Many people lose their sight and livelihood by their early 50s.
There is nothing which disables a man like cataract and poor eyesight. And there's nothing more easier than to mend it. You just do a small operation.
Dr. V began with a simple idea in an 11-bed hospital with 4 doctors, 3 from his own family. It would serve patients who could pay, but the profits would provide free care to the many more people who couldn't afford even the bus fare. So Aravind set out to find patients, mainly through screening camps in surrounding rural areas. For those needing surgery, groups like the Lions Club provided buses to the hospital, where they entered a brisk assembly line operating room. Dr. V's business role model was the American chain store.
In America, you have models, whether it is Sears stores or McDonald's hamburger, or you are able to open a chain of shops or restaurants or hotels, and you are able to organize them efficiently.
You spoke to him here. You were sitting here and he was sitting there and talking about McDonald's.
Dr. V died in 2005, but his office is left untouched as a shrine to him. His nephew, ophthalmologist Aravind Srinivasan, manages a system that's grown to 5 regional hospitals and 25 satellite clinics. This was the first one.
This is a 32-year-old hospital, so we are probably geared to see about 700 patients a day. Today we are seeing about 1,500 to 2,000 patients a day.
Each pays about $1 for a doctor's appointment. That helps fund even more patients who go next door to a free eye hospital. There's not much profit margin, so a heavy volume of paying patients, satisfied patients, is critical. Efficiency is also critical. Patients are promised a completed appointment in 2 hours. A brochure details what they can expect.
So registration takes about 5 minutes. Vision test takes about 10 minutes. Refraction check about 10 minutes.
So this is sort of like a patient's bill of rights almost.
Exactly. So they understand what's happening.
Aravind's reputation is drawing patients from farther and farther away.
Whenever you say eye operations, everyone says, go to Madurai.
55-year-old K.G. Anjaneyalu had been in a 3-year depression that started when cataracts began clouding his vision. He became completely blind 3 months ago. Anjaneyalu and his wife Shobha endured a 2-day train journey to get here.
I was a sportsman. I used to swim. After the cataract, I could no longer move around. I got stuck at home and I started eating. Then a leg injury made me even more immobile. I had problems being overweight and I developed high blood pressure.
By 9 o'clock the morning after arriving here, he was being prepared for surgery. Already dozens of patients had gone ahead of him. So you've been going for 2 hours and you've done 16
Patients, yeah.
Dr. Aravind and surgeons in several other operating theaters, or OTs, were first working the routine, mostly cataract cases.
But the other OTs are not primarily cataract surgeons. They are primarily doing either glaucoma or cornea. And then they also do some cataract to contribute to the main volume. So we are able to identify or those cases which needs a little more extra attention is segregated from the pool.
Anjaneyalu was a high-risk case, given his hypertension and obesity.
You just have a margin of safety of about 5 to 10 minutes to get the surgery done.
About 10 nervous minutes later, Dr. Aravind had removed a particularly tough, leathery cataract.
The cataract was a little obstinate, but otherwise things went on well. So he'll get about 95% vision tomorrow. So when you see him tomorrow, you'll see a different man, but more confident.
By the end of this day, Dr. Aravind and his colleagues did nearly 300 surgeries, about half of them free of charge. Increasingly, however, patients are seen outside the hospital. Telemedicine connects doctors to satellite clinics, and today's eye camps offer much more on-site, from grinding eyeglass lenses to digital scans. Near the camp, a satellite truck beamed high-resolution images to specialists at the hospital. Technology has improved care, and it's also brought down costs, notably for the intraocular lenses which are implanted during cataract surgery. They used to be imported. Aravind began making its own intraocular lenses back in the early 1990s. They used to cost between $50 and $100 each. Today, they are made in this factory for as little as $2 a piece. Aravind lenses are exported to 120 countries, and they own 8% of the global market in intraocular lenses. This factory is an example of how Aravind turned a supply problem into an opportunity. It's not just business acumen that drives the mission, but also a firm spiritual basis. It is inspired by Sri Aurobindo, a mid-20th century spiritual leader who believed that good works and good ideas are a manifestation of the divine.
Now, part of that is to recognize that whatever ideas that you get is not really your ideas. They are the divine ideas. No? So how do you kind of act on it, but then are not taking the egoistic ownership to those ideas? No, like I have done it. No? So how do you train yourself to open up?
One way Aravind has opened up or shared its ideas is by training some 250 hospitals in India and 40 other countries to adopt its methods. It's the ethos set by his uncle. Dr. V, who was single, never took a salary. In fact, he mortgaged his home to start Aravind. And he also coaxed or inspired 34 members of his extended family to work here, starting in 1976 with his sister Nachiar and her husband. Both left surgical careers in America to work here for about $20 a month.
Today, oh my God, we are very, very happy. In fact, at that time, in 80s, we were not happy. Even though Dr. V was happy, in a family life, like me and my husband, 2 children, it was not easy for us. We couldn't even buy a cycle. At that time, we didn't appreciate his far vision.
God bless you, madam.
God bless me, definitely. God bless the surgeon.
She says the satisfaction of seeing patients like Anjaneyalu restored to full lives makes up for any material privation, although over the years salaries have greatly improved for the 220 doctors and some 2,500 other Aravind staff.
My children are starting school on the 1st, so I want to get going.
Cooling glass style Hollywood actor.
We'll give you some dark glasses, just like a Hollywood actor.
He's one of 27 million patients who've been treated at Aravind. 3.4 million of them have had surgery. Over the next 20 years, the goal is to raise that number some tenfold. It's a measure of how ambitious the Aravind people are, but also a measure of how many people remain blind in the world whose vision can easily be restored. For Religion and Ethics News Weekly, this is Fred de Sam Lazarel in Madurai, India.